Jehovah God is the life giver, and He wants us to respect the gift of life. One way we show respect for life is by obeying His commands concerning blood. Jehovah gave Noah and his descendants the timeless command, only flesh with its life, its blood, you must not eat. He likewise directed Christians to abstain from what is strangled and from blood. As Jehovah's Witnesses, we conscientiously obey this command today. It also affects the decisions we make about medical treatment involving blood. When making decisions about blood, we have also been guided over the years by what the Mosaic law stated at Leviticus 17, verse 13. If one of the Israelites or some foreigner who is residing in your midst is hunting and catches a wild animal or a bird that may be eaten, he must pour its blood out and cover it with dust. However, is that law binding on Christians? The simple answer is no. For one thing, Christians today are not under the Mosaic law. As the Apostle Paul said, as recorded at Colossians 2:13 and 14, God erased the handwritten document that consisted of decrees and was in opposition to us. He has taken it out of the way by nailing it to the torture stake. Therefore, Christians are not under the command that blood be poured out and covered with dust. Furthermore, the Bible does not comment on the use of a person's own blood in medical and surgical care. Regarding the use of one's own blood, our position has been, as is stated in the October 15, 2000 issue of the Watchtower. There it says, "A Christian must decide for himself how his own blood will be handled in the course of a surgical procedure, medical test, or current therapy. For that reason, many Christians accept simple procedures such as blood tests, as well as more complicated procedures involving their own blood, such as the use of heart-lung machines, cell salvage devices, and kidney dialysis treatments. However, the list of treatment options continues to grow. Therefore, after much prayer and consideration of the Scriptures, the governing body has decided to clarify our position on the use of a patient's own blood in medical and surgical care. The clarification is this: each Christian must decide for himself how his own blood will be used in all medical and surgical care. This includes whether to allow his own blood to be removed, stored, and then given back to him. What does this mean? Some Christians may decide that they would allow their blood to be stored and then be given back to them. Others may object. Each Christian must make his personal decision on all matters involving the use of his own blood with regard to medical or surgical care. In review, Christians are not under the Mosaic law. However, we obey the apostolic command to abstain from blood. Furthermore, the Bible does not comment on the use of a person's own blood in medical and surgical care. Therefore, like other choices about health care, each Christian must make his own decision about the use of his own blood in all medical and surgical care.